We go to the press conference earlier. Well, government says just to spend 1 billion of your tax cedis on the electricity bills of all of us across the country, at least those who qualify. This follows President Akufo-Addo's announcement of electricity reliefs for Ghanaians to reduce the impact of the coronavirus outbreak on the population. Energy Minister John Peter Amewu disclosed this at a press briefing in Accra today. He also spoke about how you can enjoy those reliefs announced by President Akufo-Addo on electricity consumption.
The ECG lifeline customer population in Ghana, currently it's about 1 million Ghanaian. By the customer population, we are talking about the number of meters, but not the population of people. So we're talking about 1 million meters. In some households, we can have between 10 to 5 people using 1 meter. So you can average the number of people that we're talking about. The access rate today in Ghana is about 86–87%, which means about 86 to 87% of the Ghanaian population have access to the national grid. So this directive by His Excellency the President means that about 85 to 86% of Ghanaians would enjoy this access. The customer population of 1 million of ECG is about 27.4% of the ECG total customer population. This means that at a current tariff level, government is absorbing almost an amount of 8.5 million Ghana cedis per month. For non-lifeline customers, of which 2,780,886 are residential and 1,608 are special load tariff customers. A 50% discount on their electricity bill will translate into 235.4 million Ghana cedis per month. The total relief for ECG customers per month based on the estimated revenue is therefore 244 million Ghana cedis, translating into 732 million Ghana cedis for the 3 months commencing from April, May, and June. For NETCO, a total government relief for all customers is about 47 million Ghana cedis per month, or 141 million Ghana cedis for the 3 months period. This comprises relief of about 10.9 million Ghana cedis per month, or 32.9 million Ghana cedis for 3 months, for a customer population of 569,000 live customers. A percentage representing 60.67% of the total NETCO customers, and 36 million per month, or 108 million for 3 months, for 369,000 non-live customers.
Well, regarding testing rates and cases, Minister for Information Kojo Oppong-Nkrumah said the current rate count stands at 641 after 50,719 tests were made.
You would recall that His Excellency the President mentioned that the imposition of restrictions in Greater Accra and Greater Kumasi was to allow for something to happen. It wasn't just an imposition of restrictions or what they call a lockdown for lockdown's sake. It was to allow for something significant to happen. That significant thing is what we call the enhanced tracing and testing program. We had a target, a primary target of close to about 10,000 persons that we sought to test. As at now, as at last night, as at the latest figures updated by the Ghana Health Service, Ghana's case count, as I'm sure you have read on the website, is 641 positive cases. It comes out of 50,719 tests that have been conducted so far. That is almost 5 times, or about 5 times, the target of tests that we set for ourselves to literally lock down and conduct, to give us an indication of what to do next. So just a quick update this morning. As of last night, 50,719 tests had been done. The data I want to give you is about the rates that are being discovered in the tests. The tests have been in 3 categories. There is the normal surveillance test, which is what ordinarily we would have found if we were still using the old method. Under the normal surveillance test, 13,838 people have been tested under the normal surveillance test. People who suspected they had symptoms, etc., and got in touch with 112 and the phone platforms, or went to their clinicians to be tested. 13,838. 268 of them tested positive. That is a rate of 1.9%. So 1.9% of the people who suspect they are having symptoms tested positive. Then there is the mandatory quarantine, where the state decided that we'll mandatorily quarantine people and test them once they were entering the jurisdiction at a time that our borders were being closed. It was in 2 parts, airport and Tamale. So the Accra airport and Tamale. At the Accra airport, we ended up running a total of 2,011 tests. 2,011 tests. 105 of them tested positive. In the end, that's a rate of 5.28% tested positive. In Tamale, we ran 11 tests. 10 were positive. That was 91% of that. Then we had the 3rd level of the enhanced contact tracing and testing. That is where now the public health nurses, immigration, epidemiologists are going out into the communities or the hotspots and are chasing, literally chasing or going or seeking to go ahead of the virus to find it and not wait for it to manifest. We have done a total of 34,859 tests in that enhanced contact tracing and testing category. 258 of them were positive. That is 0.7%. So if you put it together, as at last night, we had done 50,719 tests, and 1.3% of the people we have tested are positive. So it begins to give you a sense that this entire, what you call lockdown that has been done, for the major objective of literally trying to get ahead and find out how much of the virus we have in the system and deal with it, we are finding out, as at the data from last night, that just about 1.3% of the at-risk populations that we have tested are the ones that have tested positive. It begins to give you an idea of the level of challenge we have in the system. As we have mentioned, it is elements like this that would inform the president's decision of what should happen next.
The minister also spoke about funerals. Recently, there have been reports of morgues getting filled up. He says those are places that are not affected by the lockdown can go ahead and bury their dead only if they adhere to the not more than 25 directive. We can hear him.
Funerals across the country, private funerals across the country, apart from Greater Accra and Greater Kumasi, that have what you call the lockdown. Private funerals across the country fit into the earlier executive instrument, where they happen with not more than 25 persons. But in Greater Kumasi, because of the lockdown, that does not apply until that lockdown is mended or lifted, etc.